Good morning. Welcome to the Moore Center's 5th Annual Symposium on Child Sex Abuse from a public health perspective. My emphasis on public health is deliberate, for we know that child sexual abuse is an issue that requires courage to address no matter the perspective. It is something that for far too often remains hidden in plain sight, affecting individuals within the context of families who then carry with them the pain and shame for a lifetime. It is an issue steeped, as we know, in taboo and conflicting emotions, one that literally strikes close to the home and shakes the foundations of our most significant and sacred relationships, the trust and safety inherent in our families and close social networks. And of course, as you know, the statistics speak volumes. About 1 in 10 children will be sexually abused before their 18th birthday. Yet only about 38% of child victims disclose their abuse. And nearly half of these victims tell a close friend rather than an adult or a person in authority. But of course, it is not only individuals and families impacted by abuse and the stigma that attends it. Indeed, this is extended beyond families to encompass and engulf whole social institutions, core social institutions, schools and churches among them, institutions that have turned away from confronting an issue that arouses difficult emotions and makes us profoundly uncomfortable. As a Canadian by birth, I think immediately of the callous and devastating treatment of Aboriginal people over a course of about 150 years in our country. It turns out that over 150 years, more than 150,000 students were taken from their families, Aboriginal families, and placed in residential schools. And when they were placed in residential schools, it turns out that these institutions were just rife with sexual abuse. This is a story that over the last 20 years has slowly been dribbling out in public consciousness. But it wasn't really until very recently when the country set up a Truth and Reconciliation Commission that the full magnitude of the abuse that took place was documented, acknowledged, and then efforts made at redress were made. The story of the Truth and Reconciliation Commission, and there's lots and lots of testimonials in their report, but talks about how young children were taken at a very early age from their families, put in residential schools, and largely as in an effort to integrate them better into Canadian society. The stories are harrowing in terms of the ways in which families were split up, siblings weren't able to go to school together, to even acknowledge each other, limited visitation rights for the families, and then essentially an effort made at cultural suppression. They weren't able to use Aboriginal languages. They were not able to have any sort of cultural identification whatsoever. All of these abuses, which had been documented, and a great deal of physical abuse as well as emotional abuse, but it was really the recognition that a core part of what took place in these residential schools that were sponsored by the Canadian government, but also several Canadian churches, what was clear at the core of it was the pervasive systemic proliferation of abuse, particularly appalling levels of sexual abuse that were reported. Now, of course, this story, which has really been so dominant in Canada over the last several years, is not just about Canada. And we know, as recent reports of the endemic levels of sexual abuse in parts of the Hasidic community in New York City, to the stories that are captured in film and other media about the pervasive abuse inflicted by the Catholic Church in particular. And again, the ways in which high levels of sexual abuse were tolerated, condoned, and largely suppressed in those institutions. And again, for anyone who has had the opportunity to see the very powerful film Spotlight, you'll know that it wasn't just that the church failed us, but it took a while for the media and other core institutions, including the criminal justice system, to play its appropriate role. When we think about this issue, it is, of course, critical that there be powerful condemnation sanctions from the criminal justice system of the perpetrators. And, of course, appropriate that there be advocacy for the survivors and evidence-based treatment for victims and their families, as well as treatment for offenders. But yet, as important as these instruments are, it is clear that this is a public health issue that requires public health perspectives and thinking about the problem in a more effective and prophylactic way. And here, of course, is a natural segue to the Bloomberg School of Public Health and to the Moore Center. And particularly under the leadership of Elizabeth Letourneau and her colleagues, it is this center's goal to marshal the tools of public health to make a meaningful impact on this problem, to fill the gaps in our research and knowledge that allows us to create and apply prevention strategies at a population level, strategies that will save individuals from harm and empower, indeed insist, that our institutions do better. We are inspired and sustained in this work by the Moore family, and especially Stephen Moore, proud to say is now a trustee of the university, whose siblings experienced child sexual abuse, and he himself has chosen to speak with great candor, grace, and compassion about the story of his family in the hope that such openness would change the story of other families like theirs. It is his support for the Moore Center that is the institutional manifestation of this remarkable courage and understanding that is not only a personal issue, but a public one that needs to be addressed in a public and comprehensive way. And so we're deeply grateful to you and Julia for your support for the center and its research, and to all of you who have taken the time out of your busy days to join this conversation. Thank you all for being here. Again, Julia and Stephen, thank you for your amazing and visionary support for the center.